Mobility matters. It's key to our independence and quality of life. Many of us take mobility for granted until we lose it. Mobility loss is a key feature of many health problems such as respiratory diseases, neurological conditions, hip fracture, and heart disease. Loss of mobility is a major concern for individuals and societies alike. If our mobility is impaired, we lose our independence. Healthcare costs increase, quality of life decreases. If we can reduce mobility loss, everyone benefits. But measuring mobility is tricky. Although we can look at walking speed, step count, or endurance, there is no universally accepted measure of mobility. Nor is measuring mobility in a clinic the ideal. Inconvenient for patients and resource-intensive, the clinic is also an artificial environment which can only provide a snapshot of a patient's mobility. It would be better for everyone if we could measure mobility more easily, continuously, and in people's daily life. The Mobilise-D consortium focuses on the concept of mobility, aiming to measure it reliably in the real world. More than 300 professionals from 34 participating universities, hospitals, and companies are working together to develop more sensitive and precise digital tools to measure what matters to patients, to stimulate development of therapies and personalised care to improve mobility, to facilitate remote trials, and to improve clinical trial design and efficiency. Mobilise-D is working with over 2,000 patients across Europe who have suffered mobility loss. Participants in our research wear small digital devices as they go about their daily lives. These devices measure and record multiple aspects of mobility, far beyond what can be measured in a clinical setting. Using the data provided by these devices, Mobilise-D aims to identify universal measures of mobility which can be used in healthcare settings and research globally, working with patients every step of the way to ensure that they are fit for purpose. These digital devices will also enable healthcare professionals to identify and predict changes in mobility earlier than before, enabling them to better monitor the effects of treatments and manage patient health, thereby improving mobility. In addition, Mobilise-D will develop a regulatory strategy enabling our tools to be adopted for widespread use. Mobilise-D will show that the wealth of information digital devices provide us with will enable clinicians to provide targeted, personalised approaches to patient care. Mobilise-D will provide the tools to enable individuals and societies to identify health problems early and prevent disease worsening, thereby reducing mobility loss, reducing healthcare costs, and improving quality of life.